what I'm asking for is that we stop pulling consultants away from treating patients with some of the rarest medical conditions in the world to sit in front of a computer, filling out online forms, and instead employ skilled administrative staff to do this on an integrated patient data system across our health service, saving time, money and, most importantly, people's lives.
Well, thank the Deputy for raising this, and this has been an issue of some interest to me for quite some time, and indeed Deputy Padraig O'Sullivan, member of our party, has been a very strong advocate in this area also. And I welcome the participation by Ireland in the 18 of the 24 European reference networks, because by the very definition of rare diseases, they were never amenable historically to pharmaceutical investment, or indeed the state could never invest in sort of treatments or medicines, because of the sheer volume would never be sufficient to match the investment required to research conditions or treatments for such conditions, and there's a multiplicity of rare conditions. So the European Reference Network idea is an excellent idea, where basically you pool together expertise, knowledge, and try and bring that to the patient as quickly as you possibly can. The issue now is to fund our participation adequately in these European reference networks. I've spoken with the Minister for Health on this, and it is my view now that government needs to respond to the estimates bid that has been made in respect. I think there's a bid in for about 37 whole-time equivalents across 5 ERN leading sites. We have to begin and build up the capacity. But I think you've made a very coherent case. I think we have to move on this now, because I think it's a very practical way of really giving real opportunities, because the journey for patients can be quite shocking and long in terms of multiple trips to different clinicians. Originally you might think it's a respiratory, you might think it's whatever. So there's a long journey before the patient and family can land on a person who actually knows the issue and knows what they're talking about in essence. So the reference network offers huge potential here. We need to resource our participation in it. I take that point. And as I said, I've spoken to the Minister in relation to it. Parallel with that, I know Europe, through the European Horizon programme, has commissioned significant research into treatments in respect of rare diseases, which I think is also vital, because in some instances where the market, if you like, to be crude, is not going to come up with the answers, then I think collectively the European state or the European Union, don't all panic on the fact that the European Union collectively should come together and give significant funding through the European research programme, the Horizon programme, to respond to significant rare conditions. I mean, on cystic fibrosis, for example, we've long sought cooperation with the United States and other countries to focus in on research around cystic fibrosis, being a particular condition in Ireland, but globally rare. And I think it's a good illustration of the approach that we require from a research point of view and from this network point of view.
Taoiseach, can I thank you for our response, because our lack of an integrated medical data system and the staffing to manage it denies patients here in Ireland with rare diseases access to the best possible and most cost-effective medical care in the world today. But this failure to develop and staff a proper medical data system will also exclude Irish people from fully utilising the new EU health data space, which is being designed to provide patients with access to new and innovative treatments for cancer and other common diseases that cannot be cured today. Why should Irish patients be denied access to life-saving treatments because the computer in one hospital cannot talk to the other, or that the computer in Ireland cannot talk to the computer in Germany or France? Taoiseach, we are a global digital leader, so let's ensure that our health service plays its part to benefit all of our patients.
Thank you, Deputy. And just to say, in respect of treatments, the government has substantially increased funding for new innovative medicines for rare diseases, investing 100 million over the last 3 years, or 3 budgets, sorry, and more than 100 new medicines have been approved, including 39 orphan medicines to treat rare diseases. And we also committed 2.7 million to support the implementation of the National Strategy for Accelerating Genetics and Genomic Medicine in Ireland. And as I said earlier, we've progressed Irish entry into the Horizon Europe partnerships on rare disease and personalised medicine. And I think, as I said, both those tracks, research and participation in the networks, is absolutely key, as is the implementation of the strategy on accelerating genetics and genomic medicine, a new National Office of Genetics and Genomics, the appointment of key staff. That will all be provided for, with a National Director for Genetics and Genomics, a Bioinformatics Lab Director, 2 clinical genetic consultants, 6 genetic counsellors. That's been welcomed by the rare disease community in Ireland and will be of benefit to many people living with a rare disease. But the networks need to be resourced as well. I take that point.
Thank you.